time. Welcome so much tonight or this morning, even in other parts in the in the world, to a very special round. It's called Luxe Legacy Family Research Rounds. And my name is Jan-Willem Korter. I'm the director of CanChild, Center for Childhood Disability Research at McMaster University. And it's truly my privilege and an honor to be part of the opening of Luxe Legacy Family Research Rounds, a virtual rounds clearly for families and bringing researchers together. This is in partnership with Kids Brain Health Network. And I think it speaks to the vision that Ray Martins really has for us, is a message of partnership between researchers and families, I should say between families and researchers. If we truly are striving towards research with impact, and Kids Brain Health Network has that front and center, and so do we at CanChild since its founding in 1989, to make an impact on the lives of children and families. So here we are today, 28th of January 2021, with the inaugural virtual Luxe Legacy Family Research Rounds. And I want to say a few words about Luke, not too much, but certainly the fact that he has touched many of us in our lives directly, if you happen to know Luke, but certainly indirectly through you, Ray. He always came across, I think, because your passion was also his voice, right? So Luke has impacted many of us who are here today and beyond today's rounds. And the fact that the naming of family research rounds is for Luke, I think it's truly an honor to have it. He will continue to impact us and remind us that it is about the children and the families. So I want to thank Luke, and I want to thank Ray for making it all happen. So without further ado, I want to turn it over to you, Ray, to kick off the first Luxe Legacy Family Research Rounds online. And then, of course, I'm very much looking forward to the presentation of the ENVISAGE team on of applying research to life. Over to you, Ray.
Thanks so much, Jan-Willem. And I know that Luke would definitely say that whenever he engaged with people, he only engaged with cool people. So consider all of yourselves this evening a part of the Cool Club. I just want to say hi, everyone, and welcome to the first ever Luxe Legacy Research Rounds. And we're so happy that you decided to join us for this little social experiment. My name is Rachel Martins, and I'm going to be your host this evening alongside the wonderful Dr. Kinga Posniak, who is my partner in developing this version of knowledge, what we call knowledge mobilization. This event was created as a tribute to my son, Luke, who had passed away this past August. And the purpose of it is to, as Jan-Willem mentioned, to put relevant research into the hands of families. My son was someone who lived his life with a deeply set of values about connection and collaboration and trust. And he had a way of naturally assuming, well, of course I have a seat at the table, that everyone loves me. It's just great. But in this session, we do hope that these values have become threaded through the conversations that we aim to have with many of you in the parenting and caregiver community that we actually do aim to support. And so I'd like to take a moment to briefly thank our host, CanChild Center for Childhood Disability Research, as well as Kids Brain Health Network. And Luxe Legacy Research Rounds essentially is an extension of their collaborative program called the Family Engagement and Research course. And this course aims to bring families together with researchers to learn more about partnering together more effectively in developing research. And Kinga, if you could move to the next slide, please. So the theme of our event this evening is family well-being. Research Rounds doesn't commonly have themes per se, but what tends to happen is scientists and their colleagues tend to get together and they present what they're currently working on. And this becomes an opportunity to ask questions and lend suggestions and generally become more aware of what everybody essentially is working on. And tonight, we want you to be a part of the conversation. Asking questions, share your thoughts in the comments section along the way. Please don't hesitate to write along the way as you this session as well, and we will capture any questions that do come about. And my partner Kinga is also keeping an eye on the comment section so we don't miss anything. ENVISAGE, which is why we're all here tonight, is a program that began development back in about 2019. And it stands for Enabling Visions and Growing Expectations. And as you can see at the bottom of this slide here, this was a project created across two countries, both Canada and Australia. And what's actually really neat about this project is that this was co-created with parents. In fact, my colleague Kinga put it best by saying that the fingerprints of parents stretch well across the development process of this study. So I'd like to take a moment and put into a little bit of context by sharing our recruitment video, exactly what the study was all about. So if you can move to the video, Kinga.
Kinga, do you have to put your sound on?
Okay, let's try again.
User energy. So my name's Francine Buchanan. I'm the mother of Cristiano Buchanan, who's an amazing little 6-year-old. We were basically told that he would not talk, he would not walk, he would not interact with us. We were told many times that his quality of life would be nil. There would be no quality of life, and we should consider other options. I wish someone would have told me that my child is not his diagnosis. My child is still the same child that any child would be. Coming to that expectation of like, your child will do what they want to do. I wish someone had told me that it's not the diagnoses, it's your child, and your child will guide you and lead you.
We know that parenting is a challenging task at the best of times, and parenting a child with a disability or a chronic health condition can add extra stress and worry to parents' lives. There's very good research evidence to show that parents who have children with disabilities experience a considerable amount of stress and worry. And it is our belief that a good deal of that stress and worry is potentially preventable if parents are well informed and acquire the skills that will allow them to cope with the many ups and downs of this parenting journey. ENVISAGE was developed by researchers and parents in Canada and Australia. ENVISAGE refers to a program whose full name is Empowering Visions and Growing Expectations. The program consists of 5 weekly online workshops for parents of children under the age of 6 with any kind of disability or chronic health condition. Parents can go through the materials on their own if they have the time, but they then have the opportunity to meet weekly with other parents and researchers for an online discussion. During these online meetings, we will be talking about 5 themes that we know to be both modern and important to families. The first workshop talks about the World Health Organization's way of thinking and talking about health and our adaptation of that with the F words in childhood disability. The second workshop talks about the importance of development of child, family, and siblings. In the third workshop, we refer to parenting as a dance led by the children. The fourth workshop talks about the importance of parents being encouraged to take care of themselves and why that's important. And finally, we talk about strategies for communicating, collaborating, and connecting with other parents and service providers to be an effective advocate for child and family.
I try very much to let people know most of what's unique about my children that's beyond their diagnosis, that they want to have a good life, they want to have friendship, they want to know love, they want to have enriching experiences. And that little piece of diagnosis is kind of secondary in our lives. It impacts everything, but I want people to know my children as children first. I think it's important to be a part of different studies, different research programs, that sort of thing, because sharing knowledge is going to make the world a better place for our kids.
What we hope the ENVISAGE program will do is help parents to feel more confident and competent in the choices they make, experience less stress in dealing with the situations that are imposed upon them, and most particularly feel empowered to do the best they can do as parents.
As much medical training as doctors have, none of us have crystal balls. We can't see into the future. So enjoy the little moments in life. Eventually, you'll see joy in everything your child does.
To get involved and to find out more about ENVISAGE, please visit our website.
So as mentioned before, this project was co-created by a team of researchers and parents from Australia and from Canada. And this workshop series was built using a method called integrated knowledge translation. Now, what exactly that means is that it's a model of collaborative research. So we all get together and with people who have lived experience. And in this particular instance, that would be parents. And sort of implicit in this is kind of a sharing of power, just not just where parents are, essentially told what to do or whatnot. It's more where everybody has a voice and everybody can contribute. And what I loved about this process, being involved in this project myself, was the fact that it was just such a welcoming team and you felt a real sense of value in collaboration. Next slide. Now, this super team here was an incredible opportunity to meet every single person here and to collaborate with them through the entire development process as well. Next slide. So starting out, it's probably a good point to shed a little light on the preschool years, given that's who we were chatting with through this whole process, and why it's important to focus on parents. And we all come to the subject of disability with our own prior histories. And with my family, it's obviously, my story essentially was going to be different than somebody else's story and things like that. I mean, I grew up around disability a lot, where that might not be the same, might not be said for somebody else who comes into this world of parenting and disability and things like that. So, for some people, it's entirely new territory. So the question is, and this is something that I would like to bring forth and introduce as well to two of our parents that are part of the ENVISAGE team. So Rose and Vicky, if you could take yourselves off mute. And I just wanted to ask you both today, so what are some feelings that you think parents tend to have around this time? Or even what were your own experiences? What were questions or issues that may have come up around then? Why do we need to focus on parents?
Okay, hi everyone. Can you hear me?
Yeah.
Yeah, good. Well, I'll go first and say hello and thank you, for joining us here today. If I'm going to answer your question, Ray, I'll have to take you back 15 years to when my firstborn son, Eric, was diagnosed at 4 months of age with a brain malformation after the onset of seizures. And at the time, like so many others, you've had being taken into that horrible room and you're giving a diagnosis that's utterly devastating. And at the time, like so many others, we had the traditional and old-fashioned view that, when you're presented with an impairment, you have to fix it. And because of health in your child and your family, it's only possible if you're fixed, right? So, we naturally threw everything we had at fixing this problem. We knew we couldn't fix his brain malformation, but we could try every miracle cure, every therapy, every crazy and not so crazy idea. And, every hour and every minute was exhaustingly, taken up with this plan. And it was this unspoken theme in our family that, everything else would stop and we would begin our real lives again, once we dealt with this issue. We had no frame of reference, and no one really to tell us that, this wasn't a sustainable and the best way forward. It was only a chance meeting with a mother or who had a piece of wisdom, or a social worker, who would pass on a little bit of advice, or a neighbour that would insist, no, you need to look after yourself, you need to take a nap. But I started to build my own way of thinking and navigating this path that allowed us to find our family and our child's identity within this kind of limbo land. But what if there's a way to give parents a roadmap early on in the journey? and you know, the roadmap that we didn't get 15 years ago, and still today that so many parents are just not getting. You know, and understanding that the health of your family is not linear, and it's not the solved or fixed end result that gives your family and your child their identity, but there are so many other interactive factors. And, you know, what if we could have permission or understanding that, you know, we can grow our families, we can develop, and it won't be anything like you expected and never in a straightforward way, but, you know, it will happen. And that's what we're trying to do with ENVISAGE. This opportunity to intentionally support families with tools and, you know, new ways of thinking, so you know, life can be experienced in a much more positive way.
And how about you, Vicky?
Hi, everybody. Yeah, thanks for sharing that with us, Rose. I think every parent has their own story to tell, and you know, I have a daughter with a disability, and she's almost a couple of weeks short of 29 years old. So I've kind of, as a parent, have been parenting for a little bit longer than most new parents. So it's you know, it's a long time since we received a diagnosis. But thinking back to that time, you know, I can't reiterate how important that initial period of your life around the diagnosis is, and the impact that time when you receive that information has moving forward. You know, it really sets the scene for how parents deal with this information, this new information that is life-changing. But one of the things that strikes me is that over the years, you know, I get an opportunity to talk to other parents as well, and it's really astounding that really a lot of the attitude around that and the way that information is delivered, it hasn't changed a great deal, which is, you know, a bit unfortunate. But hopefully, you know, professionals are starting to get, and doctors are starting to get more aware of this, and you know, I'm certainly looking forward to that changing over the years. You know, I don't want to underestimate, I think I want to highlight the importance of parents feeling like they need to tell their story. And I suppose that's part of the adjustment and the grief process that all parents go through, you know, very uniquely in their own way. But telling their story, their diagnosis story is really important, and it makes a real difference to the way that they cope. And often, you know, telling their story to other parents is something that I hear a lot of. You know, when my daughter was diagnosed, this was almost, you know, pre-internet, I suppose. There was very, very little information around at the time. And I wasn't exposed, unlike Rachel, I wasn't exposed to disability, and I was quite young. So getting information, finding information was really, really limited. So, you know, one of the things that I did was connect with other parents, because of course they know, you know, that they're a wealth of information. And of course, you know, we took on all of the information from the doctors and from all the medical staff around me, but I just wanted to have that other perspective. So, you know, my journey, I got a lot out of connecting with other parents, and, you know, that developed into creating a support group for parents. So the early years on, I was very much part of a support group for parents, which has now developed into being an organisation called the Cerebral Palsy Support Network, which continues to support parents in other ways. But I went into, very much like Rose did, the fix-it mode. And so, you know, I was seeking out information, I was doing all the therapies, I was doing everything I was told, because I was going to fix this child's disability. And I didn't see that there were other ways. And when I came across the F words, and when I saw ENVISAGE, I discovered ENVISAGE, you know, I was almost, I suppose what I hear a lot of parents say is, I thought, well, where have you been all my life? You know, where is ENVISAGE and the F words? But it has been, because it was the answer to everything that I was looking for in those early times. And if I'd had that then, would I have coped better? Perhaps. But, you know, it's given me, ENVISAGE has given me a new lens, a new way of looking at living with a child with a disability. I mean, you know, the other part I love about ENVISAGE, which is, you know, the question of why we need to focus on parents, is if we can empower parents, then they'll raise children who will also be empowered. And, you know, it goes hand in hand. You know, parents that do well, that are empowered, that have the information, that have the support, that have a good way of looking at the world and their child, will often raise children who are well, you know, adapted and do well in their life. Yeah, so yeah. So that's my story, and yeah, I think ENVISAGE is a wonderful thing about, you know, connecting parents and giving them an opportunity to be part of such an important project. So thank you.
Thank you both, Rose and Vicky, for your comments there. I think just to kind of package exactly what you said was that despite the fact that we've all had such diverse experiences as well, that at the end of the day, this point of time seems to be something that hasn't really developed over the years. I mean, my son passed away just before his 14th birthday, and the fact that I'm still having conversations with families that are very much similar to that effect means that this is a part that needs to be sorely addressed. And so as we move to the next slide, I just want to take another moment to introduce Dr. Peter Rosenbaum and Dr. Laura Miller, who are going to fill you in a bit more on the project itself.
Hello, and thank you. And it should be obvious by now why we're working with parents. Laura and I are both health services researchers who know quite a lot from one side of the table. But as Elizabeth, a parent who's with us, said to us last year, you have textbooks, we have storybooks. And that was among the most profound things I'd ever heard, because it encapsulated so beautifully the complementary perspectives that professionals and parents bring to this. We professionals clearly have a whole lot to learn from parents. The basic ideas about ENVISAGE are to validate parent experience, to empower them, and to arm them, with ideas and confidence and competence. And you've heard a little bit already in the video about what ENVISAGE is about. So I'm going to go through it very quickly. The next slide, please. What's important as an overriding issue is that we're not saying that anything you've been doing as parents or professionals is wrong. We're saying that it's not big enough, it's not wide enough, it's not deep enough. And the emphases in the program are on child and family development, on new ways of thinking about health, talking about parenting, which we tend not to do because we're so busy worrying about the disability elements, talking about family as a unit and being family-centered, taking a strengths-based approach to everything that we do as professionals and families, and bringing future into this, because children are a work in progress. Adults are as well, but we don't have as far to go. Anyway, that's the broad concept. Next, please. So you've heard a little bit about this in the video, and that video was made when I had short hair. And you'll see that I haven't had a haircut in a year. So the first workshop talks about new concepts in health and builds on the World Health Organization's ideas, which basically expand beyond the medical issues to think about the implications of medical issues. And we talk about the F words, which we can discuss another time in more detail. In the second session, we talk about development, and not just about child development, but about family development. And related to that, in the third session, we talk about parenting and the idea that children are constantly changing, and that if we're doing a decent job as parents, we're following our children's lead and building with them what they're interested in and how they do things. In session 4, we talk about how important it is for parents to look after themselves. And I often have said that as a pediatrician, I ask parents how they're doing, and they say, "Oh, I'm fine, don't worry about me." And my answer back with a wink is, I actually don't care about adults. I'm a kid's doctor. but I know that how you're doing is probably important for your kids. And we get into a conversation in the workshop about the various ways that people can take 5 minutes or half a day, to look after themselves, to be aware of their own needs and in context of their family. In the 5th session, as was said in the video, we want to talk about ways that families can use the ideas that we're presenting and that they are sharing with each other to communicate with their own families, to communicate with health professionals, educational professionals, community professionals, and so on, and be equipped with the new ideas and ways of sharing them. Next, please. Laura and I started talking about this project in 2017. I had the privilege of being a visiting professor in Australia for a few years, and this is where the project started. And as you'll see, things take time to develop. We've done a lot of work in the workshop development with a group of parents who participated with us and helped us bring the ideas together. We then had another group of parents, the green parents, who looked at all the material and gave us feedback about it. We have then done the pilot study with 70 parents, usually in groups of 4 to 6 parents at a time over 5 weeks. And we're now looking at what those parents have told us, both in interviews and using questionnaires. And as you see, we've got 90 parents who have their fingerprints all over this. And what we will probably do is a bigger randomized clinical trial to see what the impact of this program is when it's spread out more widely. Next, please. What have we learned? Well, you can see that we've found some happy kids with great smiles. Next, please. So parents need knowledge, support, and resources. And this is a comment from a parent. That was the biggest barrier. You don't know where to go. The information is not readily available. You have to go look for it. And parents are exhausted. And parents who are listening to this will know this. There's too much put on parents. And it's interesting, actually, to make a comment about Vicky saying when she was a young parent, the internet didn't exist. Maybe that was okay, because the internet, I think, is a double-edged sword. So finding information is one of the many challenges for parents, and knowing which sources are respectable and reliable. Next, please. As a mom, a special needs parent, I heard a lot of what won't, can't, and doesn't have the ability to do, what I call the catalog of doom. And ENVISAGE is not like that, and it was a breath of fresh air for me. We're certainly happy to hear that. We're certainly also incredibly disappointed that this is still the way things are being done. And we'll have more to say about that in a minute. Next, please. Interventions for children with disabilities must prioritize well-being of the whole family. We still have children's hospitals. We don't have children and family hospitals. And the focus so much, as you heard from the parents who spoke, is on the child. So talking about parents, their well-being, their health, you just don't think about yourself. You're not allowed to, because you're so busy being a parent. And this is true for most parents, actually. You're on autopilot for a long time, and it's not until you see the effect, you see how it's affecting the family, that you actually do something about it. And even then, it's not easy to do. We're not pretending that any of this is easy to do, but we hope that a new worldview allows people to expand their scope and their horizons. Next, please. Programs for parents must be flexible and accessible. And we're having lots of really interesting discussion right now about how to move this forward, how to make this a self-sustaining program. And clearly it takes time, technology, as we've seen tonight, with systems that may or may not work easily, language barriers, quite frankly, even English. If we don't talk in plain language, we can confuse people with our jargon. Cultural barriers of various sorts are a reality in both our countries, because we are so incredibly multicultural. And then having the headspace to be able to take time, take an hour and think about and participate in these things. All of these things are realities we are aware of. Next, please. This is the punchline, in a way, one of the punchlines. ENVISAGE, the program that we're engaged in now, is We have been told by virtually every parent who's participated in every stage of this program, you need to develop this program for service providers. And if all of you will do what Peter Pan did and clap your hands really loudly and really hard, CIHR, Canada's research agency, will give us a grant to do ENVISAGE SP. And we have a huge amount of interest from service providers in both countries to bring these ideas to them, because clearly that's how the system will change. Laura is very engaged with ENVISAGE First Nations, and you should talk about that one.
Thank you, Peter. So we are very fortunate to be able to engage with Aboriginal and Torres Strait Islander families in Australia to be able to develop ENVISAGE First Nation peoples. And what we're learning from that project, we will also be hopefully going to be able to translate to Canada. So I am starting the process, as you've seen, with ENVISAGE from the very beginning in terms of establishing caregiver partnerships with Aboriginal and Torres Strait Islander families and communities who are raising children with disabilities. And we have received funding to commence the next 2 phases of the projects. So we're looking at the ENVISAGE materials, and we are developing those to be culturally sensitive and culturally appropriate, and being able to engage with community-based organisations who are led by Aboriginal and Torres Strait elders, parents raising children with disabilities, and also employing research assistants who have Aboriginal and Torres Strait Islander backgrounds. So it's a very exciting project that we look forward to be able to present to everyone in future family research rounds.
Thanks. And what I hope you'll recognize from this, and also from ENVISAGE Croatia, which Monica Novak is doing with us. She is a member of the ENVISAGE team, and she is from Croatia originally, and she has translated all the materials and is doing a pilot study of what we've been talking about in her own language in a different country. So what you see from what Laura's doing and what we're talking about with the service providers and what we're talking about with Croatia is that this is not a cookie cutter. What it is a broad recipe into which you can put your own ingredients depending on what the ingredients are in your community. And we're really trying to study this carefully, because we don't want to throw it out there and just say, well, this is great, without knowing how it works, without knowing how it needs to be adapted, without knowing what works better and what needs to be changed. So this is the research element of this whole program. And I think that's all I have to say.
So I just wanted to take a big moment to say a huge thank you to, and I see a few people in the participants list as well too that are recognized either from participating in our workshop cohorts or who helped assess some of the workshop materials and things like that. So a huge thank you from the entire team, from us to you, for helping us out. And we are all so much better when we work together as a community, much like the penguins all together there. And your legacy in the end is really going to leave ripples within this project for a very, very long time. And next slide, please. If you have any further questions, you can feel free to contact the team at either email address here as well too. And next slide. Now, this is a time for you guys to join into the conversation here. Now, the ENVISAGE team, if you feel like you can lend some insight to the questions here, please, by all means, feel free to take yourself off mute. And if you want to speak as an audience member, you can use the reactions option at the bottom of your Zoom screen and use the raise hand option. Just be sure to lower hand afterwards. We'll be paying attention to the participants list as it'll triage how many people raise their hands there as well. And you can also ask questions within the chat box as well, and either Kinga or myself will ask on your behalf. But while we wait for to see if there are any further questions, I'd like to ask a few questions of Rose and Vicky as well too, and perhaps some of our team if they have any insights as well. How do you feel the ENVISAGE workshops fit into helping promote family well-being? Or where does it fit in your mind? What are some of your initial impressions of our work so far?
Can I start with that one maybe? I think the first thing is about connecting with other parents and having the opportunity to, you know, tell your story in a supported and safe environment. Having the tools that you get and the strategies that you learn, both from the content of the workshops, but also from all of the outcomes that come out of the conversations. So, you know, you learn things that you may not have thought of in the past about how to cope, you know, with the day-to-day world of raising a child with a disability. So, yeah.
For sure, I completely agree. And I think that in some cases as well, the perspectives that you have when you're trying to absorb all of this new information can kind of mess with the idea of what it means to parent in the long run. And I think about some of the conversation. So for a little context, within the workshop series, there would be a parent and a researcher. So in the Australian team's case, that was Rose and Laura together. And for the Canadian one, it was Peter and myself. And I remember a few times where Peter would mention, you want to brag about your kid? We'd like to hear more about your kid. And sometimes people would think that that was opportunity, say, to give a brief medical history. And that kind of hit me hard personally as a parent, because that's so much how we see initially for some parents is the medical hat is on first. The mom hat, I may have left at home or something to that effect. And then Peter would kind of gently encourage, like, well, what do they like to do? And they're, oh, well, they like to play Xbox or, you know, this, that, and the other thing and stuff like that. So it's little leads along the way that kind of help people to see that, you know, it's moms still keep doing mom things and dads still keep doing dad things. It's just a little different, and that there are other people who can help you along the way as well. Does anybody else have any responses as to how they feel this ENVISAGE helps promote family well-being?
Yeah, I'll just jump in quickly and say that, you know, we even had a couple of, you know, partners, so mum and dad, you know, doing the workshops in some of our workshops. And, you know, it was a really great opportunity for them to hear these ideas and share and bounce off each other. And that was a really lovely thing that we saw as well. And, you know, and some dads who did it by themselves and some mums, and, you know, and it applies to all caregivers. And I think that's a really good thing, that it is just it's a space. It's just an opening for these people to come in. And yeah, we present the ideas, and, you know, these ideas are great, and, you know, we've worked on them for a very long time, but, you know, it's those little light bulb moments that you see, and it's those little, you know, bouncing ideas off each other, whether it be, you know, and even the making of friendships that are going to support you lifelong. You know, that's always been the best thing for me, is finding people who I could share and bounce ideas with. And it's not even finding the answers, but it's just having that space.
Absolutely. And from the comments section here as well, too, I can say that we have a few parents who were a part of the program saying that they would do it all over again, that it was wonderful and incredibly helpful. And 5 weeks went by so quickly. And then someone agreed here as well, too. And someone else here, Jackie, also says, I missed that this was for families with children under 6. It all sounds wonderful and exactly what is needed. That's really wonderful to hear. And so to the audience, I want to ask as well, too, if you're here as a parent of a child with a disability diagnosis, what are some questions or issues that arose for you early on after diagnosis? Looking back, what would you have found helpful, and what would you want to tell your younger self?
Right, I just want to say, I think I saw a raised hand from the Gail.
Yep, Gail, would you like to come off mute?
Yes, I'm off. Hi, Rachel. Good to see you.
Good to see you too.
Anyway, everyone, this sounds so exciting. I put in the chat box that my young person with a disability is now 29 years old. So same as Vicky's child by the sounds of it. But my question was, my child was born with more really complex medical problems, which of course it's turned out that they've been quite disabling. But I think when he was a baby and a preschooler, I would never have thought of him as a child with a quotes disability. So I'm wondering if this workshop is for, and the parents who participated, whether it was for children with maybe, I don't know how to say that, who maybe had complex medical problems, who hadn't clued in yet to the fact that their child had a disability or might have a disability. Yeah.
Fair point. Peter has an answer for you.
I want to make just a quick comment, and that is that the focus of developmental pediatrics is essentially what are the implications for child and family development of a child having any kind of complexity.
Yeah.
We work in the field of so-called disability, and that's a whole other evening's discussion, what we mean by that. But I think Gail's question is really important. I think these ideas are non-denominational. They're not about cerebral palsy or autism, and they're about the challenges for kids to develop in the face of medical or developmental issues, for families and so on. And there are a set of concepts. How they're operationalized and used will depend, it depends on your storybook.
Yeah, I just think it would have been so helpful for parents like, you know, like me at the time. Yeah, so I think it's hugely transferable across a spectrum, probably for all parents, but for any parent who has a child who, for whatever reason, there's a little bit more complexity in there. You're in and out of the hospital, in and out of pre and post-op stuff, and inevitably all the stuff that goes along with that. Yeah, thank you.
Absolutely.
It sounds like a great project.
Oh, sorry, I missed what you said there.
Sounds like a great project. Now I just have to get my hand down. Okay, thank you.
Yeah, we definitely had quite a variety of people, and that started right at the beginning with our inclusion criteria, in terms of which inclusion criteria means who are we inviting to do this, and so there was quite a broad variety of experiences from I can't even begin to expand, but you know, disability is a broad spectrum, and we came to represent essentially.
We could explain again very briefly. We started with families, inviting families of children under the age of 6. Many of the parents who looked at the material have kids who are 10 or 15 or 20 and said, I wish I'd have this, or I'd had this, or why can't we do this? And the answer is, from a research point of view, we want to get it right. And we are definitely going to expand it, because as has been said, these ideas are probably relevant to people at different stages and at different stages in their own experience, even if they've done it before. So we're not discriminating against, we are simply trying to be cautious and careful.
I can just add there, I can see in the chat box that there's lots of comments about different life stages and transition to school, and that's certainly the feedback that we've received from families about having additional workshops that follow on from the 5 workshops, or workshops that are specifically designed for different life stages. So we really appreciate those comments.
Absolutely. And Daniela has a question here.
I don't have a question, I have a comment. Yeah, well, I learned, obviously I wasn't a part of 1 to 6 or 0 to 6 parents, but I did look through all the materials. You can see Vasilia, he is 18. And today I was thinking, we were at the appointment with a surgeon, something completely new to me. And I was looking the parents around. And this is really about empowering parents, because whatever you know and whatever they know, it will come to me to decide if my son is going to have a surgery or not. Is it helpful for him? Is it, you know, is it going to fulfill, or, okay, well, we will discuss about the surgery. He doesn't like it. So, and it is not only about, I think it's applied to all families. I saw many, you know, like healthy children. I mean, healthy with no disability, but they were there because of some kind of surgery. That is probably, you know, one-time thing only, but they were scared also. So they need to be empowered as well. So I really think that all these ideas must be spread to everyone. Thank you.
Absolutely. Absolutely. There are many points that could definitely be applied for a lot of people. Looking forward to seeing what we envision in the future. And if you have ideas as to how you feel like you would want to receive a lot of this information, we are definitely open to conversations in that respect in terms of, we were discussing a variety of applications, actually. One of them was talking about a book club. Would that be cool? Things like that. We have, we're in the imagination part of the process here, I guess would be the big part of it. Well, if we have no more questions and comments, I'll definitely say that we are glad that, oh, sign me up for the book club. Sounds good. We are definitely glad that you all, oh, Elizabeth, did you have a comment as well?
I was just going to say, from my perspective, I was a participant in the ENVISAGE program, and I just want to say that I have both a 2-year-old who's complex medical care, but then I also have a 23-year-old with different disabilities. And I just want to say you're exactly right. It is applicable no matter what the age, what you're going through, and even for my neurotypical child. So I can't stress how important this course was and how much material was in it. But then also the networking. I met so many incredible people, even though we're such a small group, but people that I still connect with after the day that are now part of our village. And to see, that's one of the things that I found most lacking, was getting those connections of people that really understood what you're going through and all the different aspects of people you could talk to. And so I really am so grateful to have been invited to be a part of this, because it really was impactful. So thank you for what you put together, and looking for part 2, totally in. And the book club.
Oh, that's great. We're very happy that you guys have enjoyed what you've heard about so far here.
Can I just add?
Oh, sorry.
Sorry. I'm a seasoned physiotherapist from Ottawa, but I work, I volunteer, and I work full-time as a volunteer with different NGOs in India. And right now, I mean, as a volunteer, but right now I'm very excited to see like how flexible, how it could be adapted to different cultures, different settings, and how right now you're working on the First Nations and Croatia. But already I can see it being adapted to different settings, because already where I collaborate with in rural South India, we are trying to touch on many of these topics, and but you know, putting in there a bit of the cultural adaptation and the stigma and so on. Anyways, thank you so much, and I look forward to seeing the full ENVISAGE workshop package. Yeah. Thank you.
I was just going to say, Marie, I do a lot of work internationally as well, in Vietnam and Bhutan, Vanuatu, Timor-Leste, and we...
I was in Bhutan. I'm in Bhutan too.
Oh, great.
Oh,
it's
Laura?
Laura from Australia.
Yeah.
So Ability Bhutan Society is who I work with.
Yes, Beta Gini. With Beta, I work with Beta too. Okay, yeah.
Okay, we need to connect. So one of the things that is ENVISAGE International, and we are looking at low and middle income countries. So that is definitely one of the steps that we're going to be moving forward. And so I would love to connect with you. And
that's fantastic. Yes, I was in Bhutan with HVO, so, and I work with Beta. Okay, thank you. Yeah.
Great.
And we have a few comments here as well too. Michelle mentioning, I have my fingers crossed for the service provider version, and I'm wondering how it might compare to the parent version. I'm not sure if Laura or Peter may have a few comments in that respect.
Do you want me to take that one, Peter? So we're in the process of partnering with service providers and the ENVISAGE team. And we are anticipating that we're going to build a series of workshops based on what we have learnt so far from parents, and parents are critically involved in the service provider version as well. So we're taking a similar approach in terms of a co-design, but based on the similar themes that parents have identified to us are the big issues that we need to be talking to service providers about. But we're anticipating that we will do a similar 5-stage process of partnerships with caregivers and service providers, the development of workshops with key stakeholders, testing that with focus groups and interviews, and then a pilot study. So that is the process that we'll be taking, and very keen if people would be interested in participating in that journey.
Yeah, I would add to that we've been learning in evaluating the ENVISAGE program that the demands on families are considerable, even the families that are keen to do this. We hope that by building this potentially as a program that service providers can do for credit, we all as professionals have to build up our credits with our relevant colleges, that would be an incentive for people. That's number one. Number two is that we will probably be more directive in assigning people some challenges before each of the sessions so that the sessions are meaningful for them. And thirdly, that the challenge that we will face and provide to others is, first of all, do you understand these ideas? If you don't, let's talk about them. If you understand them, how might you be applying them with families, with colleagues, with the people who are your bosses and so on? So there's a different set of foci, but the content will be the same.
And a few last comments here. One of them, Gail mentioning, are your early research findings available yet on the website? I don't believe so, but what I can do actually, Gail, is connect you with the appropriate people. If you want a few more details, happy to do so, given the fact that I know you. And as well too, I would say, Jackie mentioned as well here, an important part about a new diagnosis is finding families and people who speak the same language. And if that isn't exactly what we are trying to do with ENVISAGE, I don't know what is. So this is just a wonderful experience to be able to share this with you guys tonight. I think it's actually, given the fact that this is something based on the memory of my son, I can definitely say that his memory is really, truly represented in this conversation this evening. He was a young man who set out to teach the world that he was worth engaging with. And if you didn't align with that sort of thinking, he would pinch you because he wanted you to see things from his lens. And that was honestly really hard to argue with. Not that I'm really recommending you going out and pinching scientists and researchers, not anything that we're publicly endorsing today. But I do want to take a moment to remind you that these research rounds are an extension of our family engagement and research course. And if you'd like to know more about it, we would be happy to connect with you as well too. You can learn more about a lot of this information on the CanChild website. And please do consider joining us next month for our next research rounds, as this will be a monthly event. We will actually be talking about the family engagement and research course, but a little more within the context of what it means to families and what partnership is and what it looks like when it comes to partnering in research. So we're very much looking forward to introducing you to the family engagement and research course team. And thank you actually from my spouse as well too. The fact that we are here because of the kids is a really big deal, and it's much appreciated. And I look forward to seeing you guys next month. We will have more details coming out very soon in terms of what the date is and the time and stuff like that.